Welcome back. This is Sleep Better TV. My guest, coming to us from his offices in Fort Worth, Texas, is Dr. Mitch Condit. He practices cosmetic and restorative dentistry and treats sleep-breathing disorders. We're discussing pediatric sleep apnea in this segment. So if a child snores when they're sleeping, should the parents be alarmed?
Absolutely, particularly if your child snores very loud or a lot, or even wakes up in the morning very tired. These could be underlying conditions that can severely affect the brain and the heart, known as sleep apnea.
So how do you determine if a child has sleep apnea?
So to determine if a child has sleep apnea, we would send the child to a sleep clinic where they stay overnight. They're hooked up to a bunch of wires and they're monitored throughout the night. It's really not an invasive process at all. It's actually very easy. The sleep study clinics now are actually pretty nice. The rooms are almost like hotel rooms, and the parent can actually sleep in a bed next to the child. So you get in 7:30, 8 o'clock at night. They hook everything up to the child. You go to sleep. You wake up the next morning, and that's pretty much it. It takes them a little while. They'll look at the studies and the report, bring you back a little bit later, and actually be able to tell you if your child has sleep apnea or not.
So with children in mind, what are some of the treatment options?
Well, occasionally it can be something maybe as simple as removing adenoids and tonsils and possibly even orthodontically expanding the palate. There's even been children that have kind of grown out of sleep apnea because as they've gotten older, their tonsils and adenoids have kind of disappeared and their airway has gotten larger. But outside of that, the treatments are pretty much similar to an adult, and that's going to be a CPAP or a continuous positive airway pressure device or an oral appliance.
And doctor, finally, what are some of the ramifications if the sleep breathing problem isn't treated?
Well, it's estimated that between 1% and 4% of the children in America have sleep apnea. It's even also thought that 25% of the children diagnosed with attention deficit disorder actually suffer from sleep apnea. Learning difficulties and behavioral problems can also be consequences of chronic fragmented sleep, as well as bedwetting, sleepwalking, retarded growth, and even failure to thrive can all be related to sleep apnea. So if for any reason you feel like your child has any signs or symptoms of sleep apnea, or if you're hearing snoring to any degree, you should immediately bring your child to us and let us evaluate them.
My guest is Dr. Mitch Condit in Fort Worth, Texas. Doctor, thank you so much.
Thank you.
I'm Scott Drake, and you're watching Sleep Better TV.